Well, if your feet have been feeling anything but fabulous, you are going to want to hear this. Dr. Jeff McGee here to talk how AI-powered bunion surgery is changing the future of foot care. So if that bunion is really now starting to become a pain, well, now is the time to get help. Doctor, thank you so much for coming on the show.
Appreciate it.
I was just showing him my own. I was worried that I'm forming a bunion here. So, but again, we're getting some up-close personal information here. First, for starters, let's chat a little bit about what you do, the treatments you see, how bunions form. And again, I think some people are curious, do I have one? Is this a problem just yet? When's the time to call you?
The confusion about a bunion is what is really a bunion. So the little bump like on the side of your foot is not necessarily, it's going to be defined as a bunion because it's there, but it's when it starts to get larger and starts to hurt, and really when the great toe starts to slide over toward the second toe, that's when you typically start seeing problems occur.
Okay.
And bunions are heredity, meaning someone in the family passes on the gene. That doesn't necessarily mean you'll have the bunion, but if you do, that's the driving force. Surgery corrects the deformity, the bunion. We can't change the fact that you've got one. That's heredity. So
I did not realize that it's a gene. You did say those certain things can make it worse. Heels,
yes.
Even low ones. I mean, I wear little low ones, but.
And like we talked about off stage, the point of the heel is it's not so much the heel itself, but it forces the foot to slide forward, which puts more pressure on that bony prominence, and it's the pressure that makes it grow. So
I did not realize that. So again, when we're seeing some kind of interesting images here on the screen of people that have certain conditions, we just showed what. Yeah, that looks.
Well, this is some foot care. Ulcers, wound care stuff.
Is there a point, let me ask you this, Dr. McGee, I certainly want to be proactive, but if we don't think we have a problem quite yet, is there a point where it does get too late per se? I mean, certainly we can still come in any time, but when does it become more serious?
For me, and this is the way I tell our patients, if there's a fine line between when you have pain and when you should fix the deformity.
Okay.
And that's the hard line to cross, because sometimes the deformity needs to be fixed even though you're not having pain. And sometimes you're having a lot of pain with minimal deformity. So it's kind of a gray zone of what is the defining line.
Yeah, I'm sure it just depends on each patient and have a conversation with
the
you.
lifestyle, shoe gear, etc.
Absolutely. Yeah. Well, we certainly also want to talk though about treatment, because this is pretty revolutionary. We're seeing how AI is actually
very
impacting
exciting.
surgeries.
Very
what
exciting.
does that look like now at your office? This is
so
big.
When we did a bunion in the past, I'm going to use the word freehand. You made cuts in the bone to shift bone around and fixate it free-handed. What AI does is give you the exact equipment, instruments to correct the bunion and hold it in that correct position while you put in your fixation, which once you realign the bone, you got to fixate it. So the AI, you take an image of the foot, that is then analyzed, and they give you the results. As the physician, you can tweak those results to your satisfaction, and then ultimately they make the surgical equipment that's specific for that patient's deformity. So it's not something you use over and over again. Those instruments are specifically for that patient's deformity.
Wow. So safe to say, I guess, more precise then?
Much more precise, much better fit, if you want to use that word, where you cut the bone and you get it back together. Much greater corrections, because now, for example, we had a patient that measured on their x-rays a 12-degree IM. When the analysis came back, it was a 15-degree IN. And 3 degrees doesn't sound like much until you're walking on it all day, every day.
Sure.
And it makes a huge difference.
Maybe shorter wait times too? I mean, is this a faster process?
A lot of the doctors are seeing that their patients heal faster and are back in their feet faster.
Yeah, certainly. And again, when you're more precise in what the issue is, you can correct it. And again, we're so grateful to know that this is truly changing the game. Well, doctor, this has been unbelievable to think. I mean, I wouldn't have even thought podiatry was being impacted by AI, but here we are.
I didn't either, but now it's here. So
certainly it is. As we kind of wrap, I do want to stress as well, any other just kind of general foot tips? You did mention bunions can be hereditary and other things of that nature, but any kind of things we just need to keep in mind?
Oh, all foot pain is a problem.
Yeah.
There is no such thing as growing pains. There is no such thing as my foot will hurt and it'll go away tomorrow. If it does, maybe that's a good thing, but typically it's giving you a sign, and that sign is going to propagate. So listen to your feet. That's the only pair we get.
Yeah. You got a favorite shoe brand? Not sponsored, we'll stress, but.
Sorry, Tacova boots.
Tacova boots. All right, you heard it here from the podiatrist himself. Dr. McGee, thank you for coming on.
Thank you so much.
Such a pleasant
I appreciate the opportunity.
Recap for us one more time again, is where you are for people who want to either book an initial appointment, find out more information. Where can we stay in the know? You see it there on the screen.
I do see it. I do. We are at the Foot Clinic. Oh, we're down at 250 Chateau Drive on the Crestwood Hospital campus.
Awesome. And we'll have those details on our website as well, tvliving.com. Again, this is the Foot Clinic. Dr. McGee, thank you again for coming on.
Thank you so much. Appreciate it. Appreciate it.